Well, welcome everyone to the Derm Vet podcast. I'm always excited for guests. I love having other people on the podcast, but I'm extremely excited to have my fellow mom, veterinary mom, fellow Oregonian, hanging out in the Pacific Northwest, Dr. Cherice Roth on the podcast today. Cherice and I have always connected over the craziness of being veterinary moms, but also very passionate and driven and, hard to hold us down, always doing something, it sounds like. But I'm so excited to have, again, she's a mom of two like I am. And what's really cool, besides the fact that we're going to talk about a really cool new product out today that we both had experience with, which she's the lead medical advisor for, and that is KeraVet Gel. She also is a children's author. So she has two books, and I actually have both of these books, and my kids love them. What's a Real Doctor and What's a Real Doctor Look Like? And they are wonderful books just to be really encouraging about the different ways that we can look and, act as people in our field. So Dr. Roth, thank you for giving up your time and being on the Derm Vet podcast today.
Absolutely. Thank you so much for having me. Been looking forward to this.
Yeah. And we had to really plan it out, didn't we? Because we're like, it took us a long time to get our schedules to really coordinate, but we're kind of used to that.
The stars had to align.
Totally. Well, you are still practicing, right? Like besides all the hats you wear, one of the things you do is you still do general practitioner work. So we're going to talk about this product, but I want to back up for a second and really just focus on, why. So something I don't do a ton of as a dermatologist is surgery. And I do just some, mass removals and things like that. But obviously I'm not looking at livers and taking out, a uterus. So, as a general practitioner, you're still doing a lot of surgery that can look like lots of different things. So what do you think one of the biggest issues, if we think about after the surgery, you've done the procedure, but we're looking at that incision and know that our job's not done, we still have to take care of it. What do you think are some of the issues that arise with that for clients?
Oh gosh, the number one, I would kind of put it into the big bucket of just lack of post-surgical compliance. And that can be from a wide variety of reasons, either not completely understanding the discharge instructions, having the discharge instructions be unrealistic to the life of that pet or that family, or there's some aspect that just makes it impossible. Like you can't get the medications into the cat, you can't get the dog to wear the cone, you can't keep them still, right? And so there are all of those levels that really do boil down to kind of this lack of post-surgical compliance.
Yeah. And, I think as an owner, what I've had dogs go through surgeries and, I had my previous dog had a TPLO, like, you think about the procedure itself, right? Like you're like, oh, we're going to get through the procedure. But then when that goes well, I think there's a part of us that even as a veterinarian, it's like you kind of want to let your foot off the pedal a little bit, right? Like you feel bad for them and they're sitting there and they have their incision and life takes over. And you look at that e-collar and you're like, do I really need to have that on when they're so sad after they already went through this big procedure? So I think, we don't often think about that emotional aspect of it, right? For owners beyond just, like you said, the physical and all the things we have to do. But let's be honest, like e-collars really suck. Like it's nice to kind of keep them physically away from it, but it takes a toll on the emotions of the owner to have to utilize that.
Oh, totally. And I mean, I have 6 dogs, Ashley.
I know. You're crazy. You're like
most of them are really big. And so like, yes, it's heartbreaking to see them in it. Like usually they have to be sedated more to kind of handle the cone outside of even the healing process. But truly, like it hits home when you have dogs that are over 100 pounds wielding this giant weapon of destruction. Like lamps get knocked over. I end up with bruises in the back of my legs. Like there's just this whole other kind of lifestyle portion of the post-surgical process that, gosh, the e-collar just gets in it's such a bother.
Yeah. And you probably had owners too, where it's like really difficult for, some of these dogs and cats are really smart. Like they'll find a way, doesn't matter if you tie it and do all the things, like they find a way to get around it. Or those big dogs like you have, I've had owners come in even just for mass removals I've done where they've like broken the collar off or it's like torn or, they've literally had the frustration of just being able to salvage like that e-collar and they'll go through like multiple
Absolutely.
versions of it. So we have both, been involved with knowing about this product, KeraVet Gel, for a while now, but it's been available on the market for a while too. And so let's break this down. If we look at something like, we'll talk about the logistics of it, but the like wound care, where does KeraVet Gel play a role in that like incision post-surgery realm?
Yeah, so post incision, after you've closed, what my recommendations, you're going to take that KeraVet gel, and right as you're about to take off your gloves, you're going to put some on, right? And that's going to be the tube that goes home with that pet. So it really is for that surgical incision part. As soon as you are ready to wake them up, your wound is closed, all of those things, you're able to apply that. The other pieces, though, for like if it's you've had an injury of some sort and you've had to close it, same kind of thing goes, where it doesn't necessarily just have to be this surgical incision. It's really any insult to the skin that you think your patient is going to want to lick the crap out of, right? And so really is, all of your normal wound care stuff needs to happen. You have to clean it, right? You have to shave around it. You have to do all of those things. But now you get to add this gel to it that actually accelerates the wound healing and deters the pet from being able to lick it.
So tell us what's in KeraVet Gel for those who don't know and are not familiar with this product.
Yeah, so it is it's a moist gel that allows for there to be an environment of speed in wound healing. It specifically deposits keratin right at the site where it's needed most, where you're trying to rebuild the keratin layers of the skin to help that pet to heal.
And I think that's what's really cool. Like it's keratin, right? Like it's keratin. I'm a dermatologist. I live in my career is around keratin and keratinocytes. And I think what's important for people to realize about this product is that, it's derived from a product on the human side that really looked at, wound healing and wounds like, if you're in the battlefield and things like that. So this is not just another topical. It really is something different because it is truly putting keratin at the area, which what we know about wound healing is, right, those keratinocytes are going to kind of contract in. So that protein, obviously the keratin in the keratinocyte is going to be really helpful. And there have been studies that the company has done to really evaluate this and even more on the horizon, which whenever I hear about a new product, that's what gets me excited, right? Because as a dermatologist, I hear about all sorts of topical stuff, right? Like people are always reaching out because they've got the coolest new thing. But my first question is always, okay, but where's your proof? Like, where's the research? Where's the literature? And for me, scientifically, dealing with my organ, I've been really appreciative of that the companies really put research and development and studies at the forefront. Like that's something that they truly care about, the wound healing aspect. But then talk to me a little bit. You mentioned a little bit of the lick deterrent. That's a huge proponent of this product as well, is that there is the strongest lick deterrent, I believe, that we kind of have on the market. And how is that going to help with this product as far as incision healing?
Yeah, so really when it comes down to it, if your patient is licking the wound, they're introducing their mouth bacteria. There's also tension that they're putting on that wound or your incision. Some of them that go the extra mile in wound dehiscence are actually physically chewing at the site, right? And so not only are you left with trying to redo the work that you've done if there is a dehiscence that's involved, but also you're now having to go back and clear up any destruction and any potential infections. And so this lick deterrent was the part that I'm not a dermatologist, but I loved the part that, oh, you mean my patient's nasty mouth will stay away from my beautiful incision? Awesome, right? That was the piece for me actually that got my attention when I first learned about it. And then I was like, oh, there's keratin too. Awesome.
Oh, that is so funny because I was the opposite, but that makes sense. I was like, keratin in a product. So cool. Oh, and then they won't lick it? That's nice too, I guess. That's really funny. No, I think that again, to your point, and we know there's a lot of deterrents that don't really work, right? Like, you can try the bitter apple sprays and all of that. And I'm not saying they can't work. Of course, we know that there are situations where those can help somewhat, but this is a very, very potent lick deterrent. This is a product that I have utilized so you mentioned incision's great, but also looking at anything that disrupts the skin. So I've utilized this in acrylic lesions where, again, part of the reason, right, is they really want to go for it. They really want to lick it. We know we can get deep-seated infections. We're doing all the things we need to do, but we really need help as far as the wound healing aspect of it, because those are very difficult.
Yes.
Plus, we need the trauma to stop. And what we know about some of these
Yes.
lesions where they're really hyperfixated on it is we usually do have to treat them for an extended amount of time. And it's really tough to ask an owner, like you mentioned the e-collar, to say, well, put this e-collar on while we treat, their deep-seated infection in this chronic lesion for months. Like that's kind of an
Months,
unrealistic
right?
thing to do.
Yeah, and I think the other part for me that was, to your point, there are other sprays and things like that that you can use that kind of taste bad. But a lot of those are actually like alcohol-based sprays so that the liquid doesn't sit on the skin, right? And so what I thought about the gel component of it, we know how important it is for the migration of those cells to have a moist environment. And when you think about it, we're like, okay, if I'm going to spray bitter apple on this incision, it's not only that you're spraying like an alcohol-based or something like that, that you're actually drying it out, right? You're drying out that environment, which doesn't promote that accelerated healing that we want. And so that was another piece for me that was like, oh, this makes sense on like multiple science levels, but then also just like taking off my doctor hat and putting on just like pet mom, like I hate having colors. And, we have enough things that happen that I've actually been able to use it on my pets. And I can tell you like the decreasing in the amount of licking that I've seen and how long I have to continue to pay attention to that wound is dramatically decreased, which is pretty incredible.
Yeah. I mean, I've literally had my dog going after a lesion, put it on and like watch her like for 2 seconds kind of give one lick and she's like, oh, and then left it alone, like pretty instantaneously. So that is such a cool aspect of it for sure. So when we talk about like quality of life, I think we've touched a lot on this, but we think of like quality of life for pet owners. So obviously trying to get rid of the e-collar. How else do we find this beneficial? I think, topicals can be really lovely because it does allow us to really target an area, right? Then rather than having to use something more systemic. But how else do you really look at the quality of life improving for pets, for owners regarding the use of KeraVet Gel?
Yeah, for me, it comes down to that human animal bond component. It's hard to doctor your pets, especially if you're not a doctor.
We're the worst,
Dude,
though.
I'm so bad.
We're the worst as veterinarians. I'm always like, you're fine.
Yeah, walk it off.
Yeah.
But there is that component of like, for my pets, I don't want to have to be their doctor, right? And I can really empathize with those pet parents that are maybe squeamish about wounds or blood or any of things because of their previous traumas. And so this also decreases that by accelerating that wound healing. But also there's, again, that we talk about the cone piece of it, but nobody wants to be confined when they're trying to heal. Like having surgery already kind of sucks. And, to be able to lay around on the couch without having the giant cone in the way, not having to worry about them continuing to cause trauma to the area, which may end up costing you more. I think this gel does a really good job of meeting pet families where they are realistically. They all want to do their absolute best. And we haven't really made it all that easy for them. And this is another step towards making it easier to be a great pet parent.
Yeah, I love that. Let's go over some logistics of the product. People who are listening and they're like, okay, I get it. Sounds good. We've talked about what it is and some of the applications that we'll dive in a little bit more. Let's go over kind of some just like quick, fast questions as the lead medical advisor that you can answer. If you are utilizing KeraVet Gel in a situation that's maybe like a wound, either it's an incision that's come open or whatever wound you're using it on, does it have to be used with a bandage? And if not, can it be used with a bandage?
Love this question. So no, it does not have to be used with a bandage. We know the benefits of having things out in air, but you don't have to necessarily also have it unbandaged. You really are going to want to use your medical judgment there. If it is a wound that requires a bandage, go ahead and do that. You can put the KeraVet Gel still on there, and that can be that inside level of protection. The lick deterrent aspect of it is a nice to have, but to your point, it is that accelerated healing that's going to be the real claim to fame here, right? That's the piece. So yes, use it with the bandage, use it without the bandage.
Yeah, because of that keratin, right? Being the most important aspect. Um, so obviously we talked about incisions, so I can assume I know the answer to this, but do sutures get in the way of the product? So if you have that kind of barrier that's sitting there, you've done a beautiful little incision and you have external sutures that are sitting there, is that an issue? And does it deter you from being able to use KeraVet Gel?
Not at all. In all of our studies that we've done, we've seen no difference as far as what's happening with the actual suture. What happens with the incision is that we've seen it heal faster.
Oh, perfect. Exactly what we want. Okay, flip side. You got an open wound. It's going to heal by secondary intention. You're not going to put sutures in. Is that going to be an issue as far as efficacy?
Not for efficacy. For me, the one thing that the call out that I would have is that the only contraindication of where you want to put this is you don't want to use it on like full thickness, 3rd degree burns, right? And so that's going to take a different level of care because of the severity of that wound. But really open, closed, first intention, second intention, all fair game there.
Okay, that's totally reasonable. And then if I get any third degree burns, they're not probably seeing me. I might be consulting, but they're probably involved with the criticalist at that aspect.
Oh yeah, totally.
Yeah. So besides surgical incisions, we talked a little bit about this, but where else do you find, and I think we'll learn more and more as it's more available and we kind of see the applications people do, right? As soon as something hits the field, then we start hearing stories of, oh, I used it in this case and it was really successful. Used it in this case and it was really successful. What other applications at this point do you feel KeraVet Gel can have beyond just the incisions? I know you kind of mentioned like skin in general and that wound healing aspect, but is there any particular diagnosis or any particular issue that a veterinarian may be dealing with that you feel like this could be really beneficial?
Yeah, so that's a great question. For me, in my hands, things like abrasion, so dogs with road rash, those sorts of things, putting it on those, lick granulomas, and we both mentioned that. Just how do you break that behavior of constantly going back to aggravate that and traumatize that site? Another one is, so when you're doing those really, really helpful IV catheters and you're doing the shave job, well, that is also disrupting the skin, right? And it can be really irritating. And I can't tell you how demoralizing it is to have done this beautiful procedure and to have the pet come back because they're traumatizing the IV catheter site. And so that's another place actually that maybe it becomes just part of your normal practice. After you take out that IV catheter, you're actually going to rub that KeraVet Gel on it, which is going to immediately keep that pet from wanting to lick at it at all. So that hopefully you never start that cycle. But if they do happen to have prolonged irritation, maybe you didn't add the KeraVet Gel right after the procedure, after the IV catheter was removed, you can send that tube home. And again, you don't have to worry about having the cone part of it, and really just having them apply that as many times as they need to break that cycle. So that's another really great way. So really, for me and my dogs, especially my patients, anytime I'm worried that it's a site that they are going to lick and potentially traumatize, I reach for KeraVet Gel first.
Can I give you another really straightforward, simple one we probably don't think about, kind of in the lines of lick granuloma? Simple hotspots. I have many a times had clients where their pet's flaring, over the weekend, and they end up seeing, the ER. And listen, I have so much respect for people who have to deal with urgent care and ER, but they will just be someone with an e-collar. And I'm always like, oh, like that's not going to help that's not going to help the inflammation. That's not going to help the wound. Like we're just stopping them from doing it. They probably don't feel really comfortable. So I've actually had a few where, there's some really aggressive ones where we still need to probably add some other treatment in too, but certainly like a pretty simple mild one or concurrently just to hasten that, wound healing, to your point, because even that wound healing can kind of cause some itchiness and cause them to feel uncomfortable, right? Mm-hmm. Like if you've ever had a wound that heals and it starts to scar over, like it's uncomfortable. So to be able to get through that process a bit faster and those really common, even hot spots, I feel like can be really beneficial. And part of the reason the e-collar goes on is we're trying to get them to quit licking that area. So
yeah, and honestly, I'm to the point now, especially for some of those types of cases. I mean, these pet parents, these pet families know their pets, and so we know it's a critter that tends to get hot spots in July. Like, make sure that it's in the arsenal for that pet family. So the minute they start seeing them lick or overly pay attention to an area, you can also use it in that way too to stop it from even becoming something simply by keeping them from licking it.
I love that. As a dermatologist who manages a lot of allergies, I'm always about the proactiveness. Like once we know your
Yes.
patterns, once we know kind of how your, itchiness, your symptoms behave, what can we do to give you tools that are very safe to have, that you can utilize, that maybe prevent you from always having to run into me because things kept going because I didn't have you set up for success in that situation. So I absolutely love that. Can you talk to me a little bit about like the safety of KeraVet? Like, can I just apply it once a day? Can I apply it more than that? Like, what does that look like for this product?
Yeah. So for the keratin side of the product, you're going to aim for every 4 to 6 hours. But we also know that there's going to be a lick or behavioral component. And so the nice thing about this is that it is totally safe. If you wanted to apply it 16 times in the first hour, you could totally do that. You shouldn't have to, but the amount that you apply it is not going to matter. That really it is about, especially in those first few hours, those first couple of days, the goal is to break that licking behavior. And so you can apply it as soon as you start to see them paying attention to it. For my Doberman, because he is book smart, not any other kinds of smart, it took him a couple of times. Whereas the Great Pyrenees, my Rhodesian, the first time they licked it, they wanted nothing to do with it. But, the Doberman who eats tires and baseball gloves and all sorts of things doesn't have a very discerning palate. So it did take him a couple of times where, okay, I saw you licking it. Okay, I'm going to apply some more gel. So it was only like a few more times that I felt like I had to apply it for him specifically, which, tends to go that way. Your pets, your patients, for labs, you're going to probably have to,
Yes, like
those sorts of
Doberman
things.
makes sense. I've seen some pretty wicked acro licks and Dobermans.
Yeah.
I love them, but they're a little, they're a little neurotic sometimes.
He's so neurotic. Like God love him. But yeah, truly, I mean, it is that piece of it too, of like, use it as much as you need to break that licking behavior. And then you can go to that every 4 to 6 hours for the keratin benefits as well.
So that's really good to know as far as like safety of the product. And you're not going to really have a threshold as where there's going to be a concern for like over application. And then as far as people listening to this podcast, veterinarians that are like, okay, this sounds really exciting. I'm really loving everything you guys are talking about. How can they get KeraVet? Is it something they have to have a prescription for? Is it something that, they can get through different distributors? Like, how do they actually get a hold of this product?
Yeah, so this is only sold to veterinarians. And yes, it is a prescription product. Really anywhere that you get your normal hospital supplies almost. So Vetcove, Covetrus, MWI, Victor, Patterson, all now carry this in stock. And so that gives you a wide variety of ways in order to get to the product.
I love that. Just easy, just where you get all of your other stuff. And I love right now.
Easy.
Yeah. I love at this point too, that it is for veterinarians. I think there's been a lot of thought and care about making sure we know exactly the right applications for the product, right? Getting the experience as a priority to the veterinarian so that we can really utilize it correctly in these cases, that we can really explain to owners why we would be considering using this product. I do want to give just an anecdotal experience with one of my cases. So I have a dog that I manage that has Cushing's disease, and then also, it's a standard dachshund, so all the things. So Cushing's disease and pododermatitis from allergies that we have to utilize cyclosporin on. So like lots of reasons that wound healing wouldn't be primo in this dog, typical dermatology dog.
Yeah.
So ended up with a couple masses in areas that I was a bit concerned about, to be honest. So like areas that like the elbow, when I'm thinking of like closing and how's that going to go? But this owner is amazing. And kind of really wanted me to do it. And so I was like, I'll try, but I really do think we should prioritize utilizing this wound healing product. I mean, we should anyway, but especially so in your dog, because I'm really worried about how well your dog's going to wound heal, right? Like you're on immunosuppressive drugs, you're self-immunosuppressing with your Cushing's disease, you're older. So she was totally game for it. So we ended up taking these two masses off the elbows, and it did really well. One area kind of dehisced where it wasn't being applied as well. She started using it really religiously after that. And she told me, because she'd had several masses taken off this dog before in the year or two before, she said that was and this is anecdotal, but that was, she said, the fastest, best he has ever recovered from a surgery, especially when one area that wasn't getting the product at first was opening, and she was totally sold and in love with it. So I think especially in these cases where even though I had some things fighting against me, right? Like I can't take away just because the dog needs bumps taken off, that doesn't mean I could ignore that he's got Cushing's disease and is on an
Yeah.
immunosuppressive medication. But I have to really be thoughtful of that. And she was just really blown away by how well these incisions healed based off other areas that weren't even as complicated as the elbow with tightening of skin and things like that before. So I really do think if you explain this, and she didn't have to use an e-collar and all, the dachshund going for the elbow probably wouldn't have been very successful anyway. But it was just really nice to kind of hear that from an owner's perspective, right? Little dachshund trying to be flexible. But it was great to hear that from an owner's perspective because she had experience with other things being taken off her dog and some of the complications that came along with that. And we both kind of went into removing these bumps with, like a little side eye, like, hope goes well. It went great. And it should never happen for her before. So I do think really thinking about how complicated wound healing is and having the ability to actually utilize a keratinized product that's going to help deter that trauma from licking is really wonderful. And it was just a really great case for me to see that experience with. I
love that.
Yeah. There's always the stories we have as veterinarians where it's like the case that really sticks out to you. And that's definitely the one so far that's been really, as far as wound healing after a surgery, stuck out to me. With that and kind of ending, any other things as far as use of the product or the benefits of the product you want to make sure our listeners know about?
Yeah, for me, I'll go with kind of one of my own stories. I'm not the best pet mom. I'm just not. Like, I'm doing good keeping my humans alive. I'm doing the best I can. One of my livestock guardians, so we have goats and pigs and all the things. We had gotten him castrated and gastropexied, and he's 135 pounds. And I can't have him not be able to work. And if he's in his cone, he can't work. And so this was one of the biggest ways that I had used KeraVet, because we knew like we were having a coyote problem. We could not afford to lose that livestock. So he was able to actually keep doing his job without a cone on because of this gel. And it also meant that I had to do less of going around the pasture, finding the e-collar, putting it back on him, all of the things, all of the goats being afraid of him because he's got a cone on. What is this thing? It really is, what stuck out to me was we ask pet families to do a lot. And it's because we can't do everything either as their veterinarian. But for these families, especially in that healing process, this is life altering. It's, can somebody be home to make sure he's not hurting himself with the cone on? Are we getting medications in on time? Is he comfortable? Did I make the right decision having surgery in the first place? There are all of these questions that come up that really are traumatizing, right? It adds to this. It's hard to try and do your best. And so one of the things that I liked the most about this product is that it really made it easier to do the right things. The other part that my technicians will tell you is I am incapable of putting together an e-collar.
Oh my God, me too.
Really quite terrible.
We're the worst.
That makes me feel so good because you're like so capable, right? Like, and so I also started to think about the time dedication of my team members to put together these e-collars, fight with them, get them on, all of that for pets that are sometimes already fearful, already scared to be there. I want to sit down and like, I haven't done the math, but I really want to sit down and calculate like how much time do we use putting together e-collars, getting them on the pets over and over again while they're in the clinic, right? Is there a real time savings component here as well? Certainly with the technicians and the veterinary assistants that I work with, their skills are far beyond putting together a cone, right? And so is that another way of really paying homage to these veterinary professionals of like, how do we also make their jobs easier? How do we make the things that they love to do the forefront of their job rather than, hey, can you put together this e-collar for me because Dr. Roth is incapable?
It's so true. I mean, we're the worst about doing that. But I think all these little things that don't seem like that big of a deal, right? Oh, is it really a big deal for my technician to spend 2 minutes figuring that out? But, that's if it goes smoothly, right? Then you have the one where, what size are they? That was the wrong size. Now this, then you have to store it. All these little things, we're all really busy. Like they really do add up over time. I do want to actually ask one more question because I think you brought up a great point with something we didn't talk about. Species, you're talking about like ghosts and pigs, but can you use it on cats?
You can. So dogs and cats are the only ones that we have studied it in. I may have put it on a rat so when I do surgery on rats, especially like castrations or mass removals mostly, I use like elasticon, or used to put on their hands to keep them from traumatizing it, but their mouths. And so I, in a lot of ways, treat them kind of like a tiny cat. Hasn't been evaluated in rats, but what I can tell you is that rat did not want to mess with that incision anymore. And so I think that is something we'll start to see further studies of what other species we can use it in. Can we use it in horses to accelerate wound healing? All of those sorts of things are still questions at the top of our mind. And as this product matures and really gets out into the market, I know our colleagues will start to come back with us and tell us stories where we want to dive deeper in some of these clinical studies of how do we best apply this widely within veterinary medicine.
Great. But at this point, it is labeled that we could utilize it in some of our cats that are focusing or having an abnormal wound. Excellent. Well,
dogs and cats.
Dogs and cats. With that, Dr. Roth, I just want to thank you. Wonderful as always. Just really great information. And I think just really exciting, again, to see like a completely different product, something that has a lot of research behind it, a lot of different applications. And I agree with you, really thinking of that human-animal bond, especially as someone who deals with chronic diseases of the skin. We really have to think about that, and we cannot minimize that. You minimize it until you have to go through it yourself. And so it is something that we really want to consider with our busy lives and the trauma that, having that physical restraint of something like an e-collar can provide. So if we can really rapidly get these wounds to heal better, if we can get these pets to quit licking it, it's just really nice to have a complete alternative. So I want to thank you. I want to thank KeraVet Gel for sponsoring this episode of the Derm Vet podcast and just putting really good research out there, a quality product. And I can't wait to see what other applications we learn as we have this product longer and longer.